Hi, good afternoon, everyone. Just a thumbs up to ensure you can hear me. Great. Okay. So my name is Susie Marr and I manage the Wicking Trust and I work at Equity Trustees, and the Wicking Trust is funding this grant round that you're going to learn about today. I'm joined by a colleague, Beatrice, who will assist with moderating questions. The aim of today, the most important thing I hope that you get out of today is to understand if this is the right grant round for you. This is the second information session that we've held. We held another one on Tuesday. We are super happy to receive questions from you, but we need to, I'll just move into that. We need to have the questions in the Q&A function of this chat, if that's possible. If you have program-specific questions, send those through to the email address that we're going to supply. Actually, before we get into housekeeping, it's remiss of me. Before we begin, I'd like to take the opportunity to acknowledge the Wurundjeri people as the traditional custodians of the land on which this office is located. I'm located in Melbourne. We recognise their continuing connection to this land and pay our respects to Kulin Nation elders, past and present. And we acknowledge that people are joining from lands all across Australia and acknowledge all traditional owners. So, getting back to some housekeeping. The session is going to be recorded. If you're not comfortable being recorded, which is totally fine, please turn your screen off. Please put the questions in the chat as they come to you and we'll address them. Program-specific questions, though, please email them to charities@eqt.com.au. So if you're still unsure after this session whether you're eligible, whether your program is aligned with our priorities, if you don't have the information you need, please reach out. We're more than happy to respond where we can to ensure that your time is not wasted and that you feel comfortable applying. After this presentation, we will share the slide deck and we'll also share a link to a video, which we'll get to shortly. A really important bit of information too. We had the wrong link up, and apologies to anyone who's been inconvenienced by this. There was a link that was going to another form, which is a Developing Solutions program, which we'll talk about. We're going to extend the closing date out. The right form is up there now, the right application form. We're going to extend the closing date out by a week. Again, I'll include that in the email. So I think it was planned to close on the 30th of September. We'll give you an extra week. But again, if anyone's incredibly inconvenienced, please reach out via the charities@eqt email address. We'll also update the FAQs after these sessions because obviously a number of questions that come through alert us to things we hadn't sort of thought about or hadn't felt that was important to communicate. So we'll update the FAQs too. Okay. This is the agenda. We're going to speak a bit about the overview of the Bringing Death Back into Life grant round. We're going to talk a bit about the round table that led to the establishment of the granting priorities and the accompanying documents, the aim of the grant round, some definitions, the granting principles, eligibility, which is incredibly important, the application form, assessment criteria and what we can't fund, how to apply FAQs, and what makes a more compelling application in our view. So the Wickings. I'm keen to acknowledge John and Jeanette Wicking. Their trust, the JO and JR Wicking Trust, was established in 2002, and it's one of Australia's most significant charitable trusts, distributing around $5 million annually to people, programs and research that significantly improve the quality of life and death for older Australians. Since its establishment, it has distributed approximately $74 million into Australian communities. There's a little story that I've sort of written or tried to recreate about the Wickings. Both John and Jeanette have passed, which is why we have this bequest and the will. I'm not going to read through it today just because of time, but I'd love you to take the time when you receive the presentation to have a read. I think it's really important to humanise these trusts that contribute to so much incredible social change in Australia and to understand that people's vision and generosity are behind it, and these people had their own lives, their own challenges, whilst they were obviously privileged in a number of ways, it's very clear that the Wickings experienced something that led them to call out older Australians in their will. It's a very unusual, we manage thousands of wills, and there's only I think one of 6 that does that. So there was something that led them to do that in their life, and I think it's important that we remember that, so that we can honour their wishes and their legacy. So this grant round and the Wicking Trust and the Ageing Well portfolio forms part of Equity Trustees' Empowering Change program. The Empowering Change program is committed to trust-based philanthropy, and I really don't say that lightly. At Equity, we're committed to longer-term partnerships, if possible, reducing the admin burden on you, which is why we're holding these information sessions and trying to provide as much information as we can to ensure that you're not applying if you don't align with the granting priorities or are ineligible. We try to create meaningful collaborations. We love the idea of learning from each other and sharing learnings. And in fact, reporting for this grant round will take the form of sharing learnings. It will be less about your accountability to us and more about your accountability to your peers. I'm still working out how we're going to do that, but the successful applicants will hopefully benefit from a slightly shifted sort of reporting emphasis, so that you don't feel like you're doing this, your report, to prove to us you've done the work, but rather you prepare a report and prepare information that helps build the sector and those that are in your ecosystem, rather than just informing us of what you've done. We are really interested in building the capacity of organisations, those organisations that are doing great work. We want to help them get better at what they're doing, not feel that they need to add things to what they're doing to fit in with grant rounds. So again, if organisations are well suited, where capacity building is something we're really interested in, and amplifying the voices of lived experience is really important to us too. So programs that show a clear demonstration of that will be viewed very favourably, but I'll get into that. So the Equity and Empowerment Program has 5 granting areas, or 5 focus areas. We've got equity and empowerment, children and young people, medical research and health, ageing well, which is where the Wicking Trust fits and where this grant round fits, and then animals and environment. You can see with ageing well, there's 3 key areas of focus: tackling ageism, building connected and compassionate communities, and optimising health Alzheimer's research. This grant round is focused on the building compassionate communities. I'm going to go into that detail, but whilst I've shown you the broader Ageing Well portfolio, please note that we are not looking at Alzheimer's research here. We're not looking at connected communities as such, or ageism, although we appreciate that tackling ageism is an important part of probably most programs that are working with older Australians, but that's not the focus of this grant round. So, which brings us, I suppose, to the specifics of this grant round, bringing death back into life. I'd like to acknowledge the report of the Lancet Commission, which helped inform a lot of my understanding of the importance of bringing death back into life, and also the participants from a round table that we conducted in May this year. So the Wicking Trust brought together around 24 leaders, doers and thinkers from across Australia, and the aim being to create a co-design a granting framework. So whilst we acknowledge that many people were missing from this round table, we feel that the approach brings philanthropy closer to understanding the issues. And that was really the aim of it. We couldn't attempt to bring everyone who is integral to this issue into one room, but we did try to get a spectrum, the complete spectrum of people working in this space, from those at grassroots to those who are impacting and changing policy. So I have a video that we created a video from the day that I was going to show, but tech issues don't allow that. So again, when we send you this presentation, there'll be a link to the video, and I encourage you to watch it, because I do think it provides a really a clear overview of why we're doing this, what's important, and the sort of responses that we'll be looking to fund. So as a result of the roundtable, a number of documents, we've been able to create a number of documents, and one is a really important theory of change. So the problem statement is critical. When you're thinking about your responses, your applications, you need to ensure that you're addressing one or more of the problems that have been identified. So I might take you through this, and then we're going to go into a bit more detail about as a result of the problem, what are some of the issues that older Australians at end of life are experiencing. So the problem, how people die has changed radically. Death comes later in life and dying is often prolonged. Death and dying have moved from a family and community setting to primarily the domain of health systems. Futile or potentially inappropriate medical treatment can continue into the last hours of life. The roles of family and communities have receded as death and dying have become unfamiliar and skills, tradition, and knowledge lost. There is an unbalanced and contradictory picture of death. So if we just move now to the impact framework and we look at the issue here, because of this problem, many Australians are not meaningfully connected to their communities at end of life, lack timely access to the information they need to make decisions that they need to make, are confused and overwhelmed by the disjointed systems, health, aged care, even funeral care, experience medical interventions that prolong length of life and not quality of experience. Their voices are not included in solutions, and they don't have equal access to the care and services they need. Many Australians, because of the problem statement that I mentioned earlier, don't know how to talk about death and dying, are unsure of their role in end of life, and don't know how to support someone, and don't feel supported in caring for someone at end of life. So because of the problem and because of the issues, we've developed a strategic response. And the strategic response is this grant round, which has two funding streams. The funding stream that we're talking about today is the grassroots community-led program stream. The Developing Solutions program, whilst I'll touch on it today, isn't open yet, won't open for a couple of weeks, but you can find information about that stream on our website. So there's one grant round, two funding streams. The Grassroots Community-Led program aims to, before we get onto that, I want to talk about the social outcomes, the sort of stuff that your programs need to be thinking about when you're expressing, what you're hoping what your programs or initiatives are hoping to achieve, because they need to align with these. So older Australians' emotional experience and wellbeing at end of life is valued and improved. Conversations and stories about death, dying, and grief become common. Caring and networked communities lead support for people dying, caring, and grieving. Communities reclaim dying, death, and grieving. Capacity of organisations working to influence systems is strengthened, and we have a more cohesive and inclusive dying, death, and grieving system. The type of principles that will guide our decision-making and through this process will be centering you need to understand that we will be looking at programs, I suppose, through these lenses, which is centred living or lived experience, taking considered risk. That's probably more our principle that we will be following. That means we're not expecting all of these initiatives in the community-led program to be backed by research at this stage. If you think you've got a great idea, if your community have told you that they need something and you're the right organisation to be delivering a response that aligns, but you're still trying to, you need to put it into place before you can develop some sort of evidence behind it, we're open to that. It doesn't need to be backed by anything at this stage. Additionally, though, if you've got a great idea that you think is already working and you need some evaluation to sort of to back that up, that's also something that we could look at funding. So don't only look at the program or initiative. Equitable evaluation, again, that just speaks to that we're not going to be placing burdens on you in terms of evaluation. Start with the possibility and not the problem. We really want to see sort of innovative and, I suppose, bold ideas coming through here. A lot of these problems that we've talked about have been in existence for a long time. So for change to occur, for any social change to occur, there needs to be stuff that is sort of pushing boundaries, and we're keen to back that as long as you're the right organisation or a community has sort of told you that they need stuff. They need something different. We'll support translation of stuff that's working into the mainstream systems, which I've spoken about, and sharing learnings, which again I've spoken about. Okay, so I'm going to go into a bit more detail about the grassroots community-led organisation. But firstly, I just want to make sure that everyone's clear about this 1 grant round and 2 funding streams. So community-led, the one we're speaking about today, the focus is community education, activation and inclusion. That's sort of our focus. The aim is creating opportunities for family and local communities to lead support for older Australians at end of life or be involved in support. You can apply for $25,000 to $50,000 per annum for up to 3 years. You need to be a small to medium organisation. We've already got applications coming through that are from large organisations saying they're a small part of a large organisation. It just doesn't work that way, unfortunately. If you are a large organisation, you're a large organisation. Consider the Developing Solutions program, which I'll go into. We're going to prioritise local solutions, innovative approaches, organically grown out of the community need, and those that apply an equity lens. It's already open. As I said, it's closing. It says here the 30th of September, but we'll definitely extend it by a week, and you'll be notified in around mid-November. With this Developing Solutions program, that's a systems nourishment process focus. The aim is improving working together and differently to change the conditions that contribute to the challenges older experience face at end of life. That's specifically looking at the problem statement and collaborating, so working with others, not just your organisation. You can apply for up to $150,000 per annum for up to 3 years, but it can trigger also an additional 3 years, so really 5 years. We know change doesn't happen within a short space of time, so we're with you, as partners in this. If it's clear that the stuff you're doing is sort of working or heading towards working, you can be any size to apply. We'll prioritise collaborative applications, strategic planning. So this is sort of ground that needs a lot more evidence behind it. Theory of change, a systems mindset, the strategy document, and that opens on the 7th of October. So the community-led programs grant round, which is what this is going to focus on. When we think about the aim of the grant round, you need to be asking yourself questions such as, how is our program improving the emotional experience of older Australians? How are we improving death literacy in Australia? What work are you doing to bring families and communities into the network of care? Are you making it easier for older Australians to navigate the systems at end of life or prepare for death? Is your work informed by the local community? What are they telling you? Are you considering how more disadvantaged older Australians and their families are impacted? And how will you know your work? How will you know what you are doing is working? So they're the types of sort of questions you need to be asking yourself, because they align directly, I suppose, with the social outcomes, the things that we're keen for this grant round to achieve. When we talk about a grassroots or community-led organisation, I think most of us really understand what that is, but the most important part is that you're seeking to build collective power from the ideas of the community and with those that are who are closely impacted or connected to the issue. So that's where you're getting your information from. Whilst your organisation is doing the work, you need to be informed by those in the community around you. And they've sort of identified, or you've identified potentially that there is a gap or an opportunity or a problem that needs to be solved. Your organisation has the capability and the resources and the skills and expertise to respond, but it's the community that sort of you're wrapping around your community in delivering that and responding to that. We got asked, it's interesting, in the 3 years that I've been managing this Ageing Well portfolio and the Wicking Trust, I've never been asked how old is aged, and it is an interesting question, and there is no answer, and I reached out to our legal team quite some time ago about this, and we haven't really got a clear answer, but I suppose what we do know is that older people are not a homogenous group. So depending on the cohort, we know that old age, being an aged person affects people very differently depending on their life experience, depending on disadvantage, depending on their cultural background, depending on their education. There's a number of things that impact that. I sort of trust organisations that are working with older Australians to know what older is or what an aged person is. But again, if you're unsure and it's a discussion we need to have, please reach out to the email address and ask that question. So the focus is on communities, programs that support older Australians to die where they choose with the support they need, with carers and families around them who are empowered and connected to the services aligned to their needs. So we'll prioritise local and community-driven solutions, programs that build community capacity, knowledge and engagement, support for innovative approaches that have grown organically, and programs that apply an equity lens. So your programs can target families and carers, but older Australians must substantially benefit from the work, and I'll explain what that means in one of the slides. Eligibility, the million-dollar question. To be eligible, you must have charitable status and be registered with the ACNC. You must have DGR1 status. This is a term of the will, so this is not something we can change. If you don't have DGR1 status, look around in your community and see if there's an organisation that you could sort of team up with. We can't accept auspice arrangements, and again, this is a legal requirement, and it's because of our trust law. But you know, think sort of laterally, and the organisation, if you don't have DGR1 status, but you've got a great initiative, and there's an organisation that's sort of in your community that is aligned, is values aligned, just ask them if you can sort of work together. They don't need to be actively involved to be a partnership. There just needs to be a value alignment. And again, if you're unsure about that, please reach out. So if you feel like there's, you know, an arrangement that could help you have the DGR1 status, please email before you apply, but certainly don't apply if you don't have the DGR1 status. Now, substantial benefit to older Australians. Again, the Wickings in their will called out aged people. So we need to be satisfied that the grant is focused on older Australians in either a monetary or impact sense, as opposed to targeting another class of persons or building the capacity of an organisation to substantially benefit persons other than older Australians. It's a bit of a mouthful. I hope that sort of makes sense. If you are an organisation that has been established and your purpose is for older Australians, like a NARI, so the National Ageing Research Institute, you can actually apply for capacity building funds. So your program still has to be aligned with the granting priorities, but you can actually apply just for capacity building funds. You don't need to, it doesn't need to be program specific. But if you're an organisation, which most organisations are, or a lot of organisations are, that have a number of beneficiary groups as a number of cohorts who are the beneficiaries of your program, you can be eligible for program funding as long as that program that you're applying for substantially benefits older Australians. So again, I hope that's clear. Any queries about that, obviously put it in the chat if you want, if you have a question now, or if you have a program specific one, flick us an email. The application form itself, I'm keen to ensure that everyone has the right application form because of our error. So it starts with program title. Then please provide an overview of your idea and why it was developed. Here we're after what will you do, who will it benefit, who will you work with, and where will your work happen. Describe the major activities your program will deliver for older Australians. So these are the actual activities you're going to do. You know, how does your program organisation engage? When you think about this, how are you engaging, educating and activating individuals and community to lead support? What needs or issues are you addressing? And how has a community informed your work? So what is your community saying? What are their greatest pain points and needs? When we talk about community, we also refer to stakeholders and those with lived experience of the problem. This is really important. Why is your organisation best placed to deliver this program? If you've got an idea or an initiative and you've done a landscape sweep, you've gone onto Google and you've gone, okay, and you've seen that there's 10 other initiatives like this, that's not necessarily problematic. It's problematic if you can't sort of establish why what you're doing is unique or particularly nuanced for your community, and why your organisation is well placed to do that. So, previously, if we could just get a number of sort of applications which have similar types of ideas, it makes it very difficult for us to distinguish and to understand, what value one brings over the other. What's going to show that value is the organizational alignment, so that value alignment, and also what's unique, like what is it about the initiative that's particularly unique to your community, and your response is particularly unique to that community. I think that's a really important part of the application form. Why you? Because we'll likely have a number of organisations applying with similar. We already have who are proposing quite similar programs. Community session, group meeting with community to discuss death and dying, things like that. Fine, but how do we choose you above another one of the 10 organisations? And that might be you saying that this is the type of, you do community consultation, you've been doing it for 10 years, and you really show that it improves A, B, and C. You've got great stakeholder relationships, you've got great relationships with other organisations in your community. That sort of stuff will help. Beatrice, are there any questions before I keep going? Is there anything that I should be?
We don't have any question yet.
Okay. Equity and access. So how does your program consider the needs of people experiencing disadvantage, and measurement? So what will success look like for you? With this section, what I don't want to see is just we'll do some qual and quant research and then we'll do some case studies. It's actually like, so, when this happens, we will know that it's working. I actually sort of want to get an indication of what's going to change or what shift will occur that will enable you to know that this is successful. And it may be that you're evaluating it, and that's great. So you can say, we plan to evaluate this, or, we're looking for funding. So as part of the grant, as part of our application, we'll be applying for some funding to have this independently evaluated. I still want to know what success looks like for you. The assessment criteria. These are the types of questions I suppose we'll be asking ourselves when we're looking at these applications. So how does your program positively impact the end-of-life experience for older Australians and their families? Are your program aims and outcomes clearly identified? Is there sound planning for how your program is working? And have you considered the continuation of the program beyond this funding? Is there a clearly identified and demonstrated local need? We've spoken about that. Do the activities identified effectively address this need? And have you engaged with the local community? Is the program well planned and achievable within the time frame? Is this realistic? We do see so many applications, so we've got quite a good sense of the sort of stuff that is realistic and what's not within a time frame. So particularly if this is a completely new program for your organisation. So if you're doing a certain type of work and then this is sort of like an addition, a bolt-on, we know that sort of stuff takes time. Whereas if this is an extension, if this is building on an existing program, that's different. So be really careful with your program planning and be sure that it's going to be something that you can achieve. Is there a clear link between the need, the outcomes, and the activities? Is the organisation, are you delivering it in Australia? That's absolutely necessary. Does the application identify appropriate partners that you will work collaboratively with? Again, I feel like this is so important, particularly in community settings. Even if this program itself you're not directly working with, what we want to understand is that we want to understand that you understand that you're part of sort of an ecosystem and that you're one organisation probably within a community that might be thinking about this, but who are those other organisations? Is there an opportunity maybe through this funding to join up or at least, create some sort of collaborative, even meet up? So again, think about that in terms of funding. Do you need some funding to pull some other great organisations that are in your community that could bolster your work or extend its reach or deepen that community connection? Sort of think about how funding can be used in those ways too. Is the scope of the project appropriate? And budget. Does the budget accurately reflect the scope and scale of the application? Have other funding sources been identified? and have the resources that are required to deliver the project being clearly identified. Any questions, Beatrice?
So we have a question about the capacity building project. Maybe do you want to expand that more, because they are not sure about what kind of
Organisation.
project that could be funded.
So if it's sorry, I'm not sure what's the question. Where's the I can have a look at the question.
It's at the Q&A section.
Could you just, sorry, Beatrice,
I'll send it to you at the chat.
Examples of the type of capacity building activities the grant could. Yeah, so when we so capacity building activities means actually building the strength of your organisation. So if you're an organisation that exists for older Australians, that can just be, it can go towards any of those important functions that your organisation needs to continue doing great work. So it doesn't have to, the money doesn't have to go to the specific program. It can go to any part of your, the organisation, because you're actually, because the organisation itself is benefiting older Australians. So it can, so I'm probably not being quite clear, but it just means it gives you a bit more flexibility to put that funding to the broader organisational sort of capacity, not just the program. So often, if you're an organisation that's looking for program funding, you might need to bring someone on for 2 days a week, so that person, whereas here you can just, if you've got someone already employed, that this money can go towards that person's wages or their salary. It can go towards some building the capacity of the organisation to communicate better. There's lots of different ways you can sort of use that funding. There's very few organisations probably that exist, like a COTA does exist for that reason, and a NARI, but here in this, when it comes to end of life, I don't imagine there's going to be many capacity building grants available. It'll mainly be program specific. So what can be funded? Discrete projects and initiatives, salary and support for the program, operational expenses, measurement and evaluation. We can't fund private benefit, advocacy, auspicing arrangements, retrospective activities, stuff you've already done, research projects, and hospitals, universities and research institutes, unless they're partnering with a community organisation. So again, they wouldn't kick through anyway, because they'd be a large organisation. But if you're a smaller organisation that's partnered with a larger one for DGO1 status, and it's a genuine partnership, we can look at that. So how to apply and key dates, read the guidelines. They're on the website. There's FAQs, obviously the impact framework and the theory of change, which is here, which is also on the website, but it's also part of this presentation. Ensure your organisation is eligible and read the assessment criteria. Check your work aligns with the granting priorities. That's the most important part. And obviously attend those information sessions. FAQs. So the grant doesn't include GST. So if you are successful, the GST does not form part of this. Can I speak to someone regarding my application? Can you please, in the first instance, send any questions you have to the website that we've provided you with, and we'll try and answer that sort of straight away. If there needs to be more of a discussion, we'll reach out to you. Again, we can't auspice, but we can fund where there's a true partnership that's been established. If you're currently a Wicking Trust funded partner, you can definitely apply to these. And also you can apply to either, your organisation can apply to both grant rounds. There's no restriction there as long as you fit the eligibility criteria. If you're a current grant partner, we won't be, this grant round can't be used to top up your current funding, but if you're applying, you can certainly apply as a current grant Wicking partner for an additional program. Okay, I've sort of raced through that. I was just conscious of time, but we've sort of got a bit of time. So I'm happy to take, are there any questions that people have?
Yes, so if there's an organization that have different partnerships, can they apply more than one applications for the same stream?
Yeah, yes, you can. Yep, no problem there. So you're saying so the one organisation is going to put a number of applications under the one stream. Yep.
And then there's a question. Do you view grief literacy as being a part of deaf literacy?
Pardon, I missed that, Beatrice.
Do you view grief literacy as being part of deaf literacy?
Yes. Grief. So when we look at the, if we go back to the, go back to what we're trying to work towards. So the broad goal, death, dying and grieving are recognised as part of life, and the opportunity for healthy dying, I should say, and grieving is available to all Australians. So grief is definitely a part of this. So organisations that are working to improve the grieving experience for older Australians and their families should definitely consider this grant round, assuming all other eligibility criteria exists. Are there any other questions? I probably should have taken, in terms of grief literacy, it's not something that death literacy is something we hear a lot about. I haven't heard a lot about grief literacy, but certainly something that sounds like it makes obviously a lot of sense if it's something, if we know that grief is an incredibly important part of death and dying, and that improving that experience will help to bring death back into life. So that's certainly an important part.
Melissa has her hands up. If you have a burning question, please.
I'm happy because we've got a bit of time. I'm happy to take my computer.
Yeah.
I'm happy to take a verbal question. It was just more based on time. As long as it's a general question, not program specific.
Melissa, would you like to ask your question?
I don't actually have my hand up unless there's another Melissa on the call.
Melissa Grenville, I think it is.
I popped a question into the Q&A, so thanks for answering that.
Melissa Grenville, is it? Or maybe...
Yeah, Melissa Granville.
No, Emma Beatty, is it?
Yep.
Hi.
Hi.
So we just want to know if we can put video, is there a place for videos in the application?
No, but you could put a link.
Mm-hmm.
And if your videos are on your website, I love looking at sort of this, storytelling and human stories through video. So, put the link in. I don't think there's an opportunity for Smarty Grants to actually put the video in, but you could certainly do the link.
And when you put the link, please try to avoid using any Google Drive or shared drive links, because we won't be able to open them.
Okay, great. And the other question is, are you there?
Yeah.
I've just forgotten the question now.
Oh, that's right. We can go back.
Yeah.
Thank you. Thanks, Susie. Thanks, Beatrice.
Any other questions there? Has anyone else got their hand up? No, it's all clear.
There's a question. Can consultation with community be part of the first year of the funding?
Yeah, sorry.
Yeah.
Definitely. And I should have said that. I think that's a really good way of looking at it. If you need a sort of a staggered approach because there are certain steps that you need to take to really ensure that your idea or initiative has the best possible chance in life, think about the round like that. Think about maybe first year starting with a consultation, moving into piloting, then and we could structure the grant, we could structure the funding in a way that the second year gets triggered if the first year achieves what is, it intends to achieve. So there's ways of doing that where we're feeling like the risk is mitigated in terms of we're not placing a huge amount of funding into a program that maybe hasn't got what it needs to get off the ground, but also that you've got some, I suppose, guarantee that if you achieve what you want to achieve in the first year, 2 and 3 will get triggered. We're not likely probably to back the 3 years if it's clear that you're starting on an exploratory path, but we definitely would commit to the fact that if you get to where you want to get to the end of the year, end of the first year, we would totally release the funds for second and third, if that makes sense. Okay, I think there's another question. Brazier, is it? Brazier?
Yeah. I just wanted to confirm, are universities ineligible for the larger developing
No,
solutions?
they're eligible. They're absolutely. For the developing solutions, any size organisation is
Okay.
What's really important though with that grant round, and all the information is on the website. I'm not obviously speaking to it now, but we would really look favourably on collaborative applications. So not just coming from university. It has to be really, you have to have something unbelievable for us to sort of consider it if it's just coming from one organisation, because that's not the point of that grant round.
No, I appreciate that. Thank you thank you for that. Much appreciated.
Nice. Helen Barnes.
Hi there. Thanks for the presentation.
No worries.
I was just wondering if you could provide more detail around the point around consideration of the continuation of the program beyond this funding. Like, are you expecting kind of the programs might be self-sustaining following the funding, or how much detail?
Yeah, it's a good question. I think what I'd be keen to see in this application, and again, it's not going to negatively impact you if you don't, but I suppose some thought around if once these 3 years is over, what happens then? Because grant funding, philanthropic funding beyond this isn't guaranteed. So I suppose, but it may happen. I suppose what we need you to do is sort of think about what's your plan B? How could this program continue? And I think that's where, the idea of bringing other organisations in. So it may be that the first 3 years is about sort of getting it off the ground, and then you're joining with someone who's going to communicate your program or implement it, with you. So you just need to sort of think of ways that it can have a life beyond the philanthropic funding, because the reality is it's not guaranteed.
Yep, absolutely. No, thank you.
But it's not going to impact, if we also want to back bold ideas a bit here. So if you sort of go, look, we've got this idea, we're not entirely sure, be upfront with that. That's not going to necessarily prevent you from getting through. It's just something that I think you do need to consider. All organisations should consider it, which I'm sure you know.
Yep. No, that sounds good. Like, it sounds like just a bit of a plan going forward as well. And also, I was just wondering, just for clarity around, you were talking before about one organisation can submit multiple applications. Is it then preferred, though, that just one will be confirmed?
Yes. It'd be, again, an organisation might have 2 incredible ideas that we think, yeah, this is super important to back because blah, blah, blah. But I would be much probably more comfortable with the funding being shared amongst a selection of organisation and not going to one organisation. But I don't want to stop organisations putting a few different ideas forward. But yes, the likelihood is that probably one of your ideas would get the funding.
Yeah, okay, because it's just for in the circumstance that someone needs some help with the DGR1 status, so to be able to support other organisations with that. Is that then it can be an issue then as well, is it? That you prefer just to provide one grant to the organisation?
I'm not entirely sure. Say that again. So
if an organisation was already going to submit a grant and then they've been approached to partner.
Oh, I see. Just say that. No, I think just as long as you explain that in the application, that's fine. And I think I wouldn't then look at that as being two applications in one organisation. Yeah. It's not the same.
Okay. Yes. Clarify that we're there because we're providing the DTR1 status.
Yes.
Okay, excellent. Oh, good to know. Thank you. Thanks so much.
No worries. Emma, have you remembered your question?
Yes, sorry, I did. We're just wondering how many grants you're giving out. Like, is there an amount, limit that you have?
It's not set in stone, but around 10 for each.
Okay, great. Thank you.
There's a question in the Q&A. So are you looking for pathway to financially sustainability and or commercialization beyond the first 3 years? How do you weigh innovation over path to scale and sustainability?
Ooh, can you repeat that? What's the
do you want me to repeat the question?
Yeah, sorry, yes.
Are you looking?
Would it be more helpful, Susie? Hi, it's Melissa. I can talk to that if it's easier for you.
Yeah, sure.
I'm just trying to pick up on the comments you were making around think about the sustainability of the program beyond the first 3 years. And I hear you that, there may or may not be continued funding after that, but I'm interested in your thoughts on the sources of that support beyond the first 3 years. So that's either other forms of philanthropic funding, which are, quite tricky in this area. There aren't many foundations, or it's government funding, which takes a lot longer than 3 years to get off the ground, or there's some kind of financially sustainable / commercial model. And I just wondered if you guys had given any thought to that, and then how you might weight applications on that basis.
I don't.
We can take this offline if you'd prefer.
Yeah, I think so. I think I know what you're saying, and I understand where it's coming from. I don't. Yeah, it's a good question. I don't necessarily think. I think there's other ways that ideas or initiatives, programs also beyond government philanthropy and sort of a sustainable model. I think the idea of potentially bringing other partners in who can deliver parts of the model. And I've been speaking to a potential, a potential partner sort of in another part of the Wicking Trust funding about that, sort of who else can come on to...
Like an in-kind arrangement?
Correct. Pardon? Yes, exactly. So where there's different sort of, if the program is implemented through different sort of other partners coming on board to assist with that, so it gives it longevity, so it's not the pressure isn't on that one organisation. But let me have a think about that question. And
yeah, no problem.
Yeah, because it's not something that I've been considering in terms of weighting, in terms of how it's weighted. I suppose one thing I have considered is how could I help facilitate joining up organisations who potentially should be working together to improve the sustainability of the idea or the program. So where there's sort of obvious values or program alignment, I'd certainly introduce organisations to each other and suggest trying to work together. I suppose another way we've been looking at this is, this community round, you'll definitely have the opportunity, those who are successful, to sort of work with those who are successful in the Developing Solutions program. So there'll be lots of sort of cross fertilisation there of bigger issues, those organisations, trying to address the bigger issues, working with those who are working on the ground. So again, how can you work together? Because as you know, as we know, Melissa, we've spoken about this a lot, philanthropy, government, they're not going to give you they're not the solution here. It's potentially the sector, those, all of you sort of somehow supporting each other.
Yeah, and I hear all of that. I'm just realistically, for programs to continue or for capacity to continue, funding has to come from somewhere, like actual funding. In kind is, always very, very useful, but only goes so far. So I'm just kind of using that as a question. And
that's a good question.
Yeah,
it's a good consideration. Now, can you believe I hope there's not too many more questions, because I didn't bring my charger down to this room and my computer's going to run out of battery, which is a rookie error. But but please send. So if there's, I've still got a little bit left. Are there any other questions? Or can we give everyone 10 more minutes back in their day?
There's one more question.
Okay.
So
if I suddenly die, you'll know why.
So if a public hospital partner with a community organization, and then the partners is implementing the program, would it be acceptable to the community-led?
I just need, you just again need to be, that needs to be really clear when you're applying, because that then helps, yes, because I can see that it's really hard for little ideas or initiatives who don't have DGO1 status here. So yes, you just need to put that on. And yes, you'll be able to get a copy of the recording of this meeting. So we'll make that available. I think, Michelle, I can't remember, it's either going to be on the website or with the email we send to you, but there will be a copy. Okay, thank you so much, everyone, for thanks. I think I've got enough. Thanks, Michelle. Michelle just brought me down a charger. I can't believe I did that. But thanks so much for coming and attending. I really hope this, how do you gauge organisation size for this? Oh, ACNC. So that's, you need to look at the ACNC to look at, that's how we look at organisational size. So we'll check out every organisation that applies. But please reach out if you've got any program specific information, send us emails via the charities at EQT website. We really want this to be a grant round that has only really a small handful of applications in a way, so that then you've got a really good chance of success. We hope we've narrowed this, it's a really focused grant round, as you can see. But we also are looking for new and bold and innovative ideas and partners to work with. Okay, thanks everyone.